Well, it's all in the eyes. There's more and more information from just looking into someone's eyeball. I'm here with Rob Lynch. He's with VSP Vision Care. And Rob, we were just talking about how much you can tell from looking at someone's eyeball. Can you give me an example of some things?
It's really fascinating. The eyeball and examining the eye is one of the only non-invasive ways that you can look at what's going on with the vascular system in the body. And so in a comprehensive eye exam, an eye doctor, an ophthalmologist, or an optometrist is able to look into your eye when they dilate it and take a look at the blood vessels in the eye and determine whether or not you are pre-diabetic, whether or not you're hypertensive or pre-hypertensive, whether or not you have high cholesterol. And those are often things that are not diagnosed because people don't go into a primary care physician as often as they go to get an eye exam. As a matter of fact, we know that people go to get an eye exam 3 times more likely than they would go to a primary care physician to get a routine physical. So our doctors are seeing many more people more often than typically get caught into the healthcare system or would voluntarily go into the healthcare system.
VSP just conducted a survey that revealed some very interesting information about savings.
We did. We worked with a company called HCMS, Human Capital Management Systems, and they analyzed a subset of our employers and took a look at what was going on with our claims versus those employers' medical claims. And what they found is for every dollar spent on a VSP comprehensive eye exam, the return over a 2-year period was $1.27 coming back in healthcare cost savings, which is significant. When it was aggregated across our entire business, it worked out to be a little more than $4.5 billion for those employers that have VSP Vision Care in terms of savings and healthcare cost avoidance with their healthcare plans.
Mm-hmm. As the healthcare system starts to redefine itself in the United States, do you think vision care will still be one of the top priorities as people look at their costs and try to change and better things?
Well, I think the thing about vision care, when you look at the total healthcare cost spend, we're a small part of it, but the impact of vision care is obviously significant, because if your vision deteriorates, you're going to have issues at work, productivity issues, you can have issues in your personal life. And so for a very small spend, what we found through that study is an employer can get a very significant return on their healthcare dollar spend. And so we think that as time goes on, vision care needs to be inserted into an employer's sort of wellness approach, and the data needs to be commingled from the eye exams into their disease management programs and healthcare programs. And they take advantage then of detecting these diseases, these chronic diseases that are very impactful towards their healthcare costs with diabetes, hypertension, high cholesterol, and others. And it really is part of a comprehensive approach to wellness and handling their employees' costs.
So any idea of what kind of a spend we're talking about, what percentage of healthcare costs that an employer might be looking at when they include vision care? Well,
again, the spend for vision care is very small compared to their overall healthcare cost, and as the study showed, the return is 127% ROI. So it more than pays for itself by including a vision exam at least in your healthcare package.
How efficient are providers being with vision care? Is there an adequate number of optometrists, ophthalmologists out there to service people's needs?
Yeah, our network and
with an aging population.
Yeah, with an aging population. You know, we have just almost 28,000 doctors in all 50 states, and those doctors are primarily optometrists, but ophthalmologists as well, and they're representative percentage-wise of what those two professions sort of penetration is across the country. And so there certainly is adequate access to routine vision care everywhere. And so the fact that we do have this higher frequency to go see vision care doctors or eye doctors versus going to see a primary care physician, and that they can detect these diseases long before they manifest themselves and somebody would actually go in and have them treated, is, I think, a huge advantage, and really is something that employers need to look at, again, as part of their comprehensive approach to disease management and wellness.
Now, Rob, what about LASIK and laser surgery? How does that fit into the picture?
LASIK's certainly covered, and LASIK sort of falls on the vision correction side of the equation. So our doctors are clinicians first and foremost, and so they're taking a look at the health of the eye, and then they're taking a look at how, if you need vision correction, if you're nearsighted, farsighted, presbyope, whatever, that they take care of those types of things. And we certainly cover in our insurance LASIK. And whether or not LASIK is going to work for somebody is really a conversation they need to have with their doctor, and a of terms on how old they are and what their particular vision correction issue may be. But LASIK, along with glasses and contacts and other types of vision correction, are all things that are part of what we offer.
All right. Very interesting. Anything that I've missed, Rob?
I don't think so. I think it's been great talking with you. And again, we think that the results of this study really demonstrate the fact that, at least with our network, you can experience tremendous cost savings by including a comprehensive vision exam for your employee population.
All right. Thank you.
Thank you.
You're watching continuing coverage of the 8th Annual World Healthcare Congress in Washington, D.C.